Well, good morning and welcome to Motivation by Paul.
That's heated up the room so quickly.
Let's warm up.
That's heated it up so quickly.
Let's warm up. Come on, warm up, Beans.
I'm warm now.
Welcome to 65 Beauty. We are in our theatre today, which is lovely, but
because infection and stuff can grow in hot environments. So.
Yeah. Well, I don't know about that, but you can hang your washing on my breast at the moment. It's really cold. Anyway, that's a different subject. So we've got Mandy. Some of you know Mandy if you've been to our clinic. Mandy's the one on the front desk. So welcome, Mandy. You're getting some work done. There's no such thing as a free lunch at 65 Beauty. So she's getting some work done, not paying for it, but she's going live. So you sort of are paying for it, Mandy, aren't you? In a certain way. So the title of this live is how do you deal with issues that you would normally use threads for. So Mandy's got an immune disease, which means that we can't put threads in her face. You've got to be really careful with what treatments you do with someone with an autoimmune disease. So we're going to be using filler today and some skin boosters to get rid of the aging process. So as we all get older, everything starts to go south, unfortunately. In Mandy's case, it's gone far south. It's so far south that it's almost come back up the top. Sorry, just dribbled my water.
You need to think of a comeback now.
Laughing my own jokes. So we're talking about the aging process. Can you explain to us, Bina, quickly why that happens? Why do things start to fall down when we get older in the face?
So as we age, our fat pads, which sit obviously in different areas in the face, but especially in the cheek area, it starts to shift downwards. And that's why you start to get the jowling, but also we lose collagen in our skins every year. So that's when our skin becomes fine in elasticity, and that's why our skin starts to
fall down.
Yeah.
Right, perfect. So if someone didn't have an autoimmune disease, then of course the most popular way to deal with it is to use threads to pull it up, isn't it? Yeah, that's what you would normally do.
Yeah, we'd normally use threads because we want to deal with the skin quality. So we want to help to stimulate that collagen as well as give a lift.
Yeah.
But in Mandy's case, obviously her body will see it as a foreign substance because of her condition. So we are using filler as an alternative to help with that.
Yeah.
So what we're doing with filler is we're basically hiding the illusion of the jowling. So we will be putting filler on either side of the jaw to give a more straight and chiseled appearance.
Perfect. Yeah. Are you going to do anything with the chin? Are you going to elongate the chin as well? Or
yeah, ever so slightly, so it just all kind of sits nice and straight. We're also going to put some filler in the deep lines just as they come down along the eyes, and that just happens with overtime and sun exposure. So we'll help plump that up as well.
Excellent,
and a skin booster.
And a skin booster. So one of the things that people talk about, Bina, is obviously overdoing it and looking false or looking like you've had too much work done. And of course, one of our philosophies is we try not to do that. And I think in Amanda's case, that's going to show quite well, isn't it? Because obviously Mandy, she doesn't want to look fake or false or whatever. So are you going to show us how you achieve that?
Yeah, we're just going to do a very subtle enhancement and nothing crazy.
Excellent. If you've got any questions for us, then please put it on the live. We're demonstrating a few things today. So we're going to demonstrate how to get rid of jowls without using threads, without actually pulling the skin up. So we're going to be using fillers and skin boosters to actually hide the fact that jowl is there. Because with some patients, we can't use threads. We can't lift those up as we would with other patients. So that's what Bina's going to demonstrate. You're also going to show how versatile polynucleotides are, aren't you? So one of the things that when people talk about salmon sperm or salmon DNA or polynucleotides. It's all about the amount of polynucleotide in that syringe, and we're going to be using 25 milligrams per meal, which is brilliant. So when you think about some of the cheaper brands like Lumiy's and stuff like that, they are only 7.5 or 2.5 milligrams of active product. So you know, you need 10 of them to equal one session of this, which is going to be really good. So what also we're going to demonstrate and educate you on is how you can create that look without looking overdone. So for the older client or the middle-aged client who doesn't really want to look like she's I can't think of something nice to say. I'm trying to be nice to Mandy. It's been nice to Mandy day today, and I can't think of something to say. But you know what I mean. You know what I'm trying to say. So what are you doing there, Bina?
So I'm going to do a mixture of bolus injections and using a cannula. So you can see how the gel was just starting to appear, and it's kind of ruins the way the jaw sits sharply on the face. So
for those who don't know what that is, can you point out what you mean by the gel?
So yeah, so this heaviness. So it's the fat pad that starts to shift, and it becomes quite heavy just here.
Yeah.
So what we're going to do is we're going to focus the filler in the lateral phase and then just by the chin, and that will kind of hide that illusion of the jowling as it will all become.
Okay, look forward to it.
Yeah.
So we're using a medical grade filler here. So it's 24 milligrams of hyaluronic acid plus it's got 4 mils of lidocaine. Is there any pain at all? No, she really shouldn't feel a thing with this filler. Also, for those who've had it, you'll know that it's very fine as well. So even though this is sub-Q, you don't rub it as much, do you?
No.
Why is that?
So the filler we're using, sometimes when you rub too much, you're ruining the placement of where you've you know, injected your filler, and we are doing very concentrated injections. So I'm not going to rub it because then I'm going to misplace it and it's going to, you know, affect the results.
But with some of the cheaper fillers, you have no choice, do you?
Because it kind of bubbles up and it becomes thick in certain areas.
So if you just joined us, it's this area, which is the jowl area, that Bina's going to try and get rid of using filler. Although you physically can't get rid of it, it's all about disguising it. That's what we were talking about a few minutes ago. So we're
disguising it. Whereas when we do our thread treatment, we are actually getting rid of it because we're lifting that skin and then the collagen kicks in. But with the filler, we're just...
In fact, you can start seeing that, can't you? You can start to see
how it's starting to straighten.
So we're using the filler that we still have on that 3 mil offer. So because this area needs a fair bit of filler, because obviously it's quite a large area, we've got a deal where it's what, £360 for 3 mils for facial balancing, which we really like. Or of course you can join the cashback club, which is another easy thing to do. Don't forget, whilst we're live, someone's already come up with aspirate. Excellent. So talk us through this aspirate debate.
Yeah, so aspiration is very controversial. Not everyone aspirates. So whether I aspirate or not, you can still get a vascular occlusion. So I know where I'm injecting in the face, and I'm away from arteries. And even if I did aspirate, I can still
get a VO. Yeah, absolutely. So it's all about the fact that you're glad that you're nurses. Yeah, absolutely. Yeah. We're going to be using, Emma, today we're using polynucleotides, but we're using a very strong one. So this has got 25 milligrams of active product, whereas some of the other stuff has only got 2.5 or 7.5 milligrams of the active product.
Can you see?
Yeah, but you can see that it's starting to go, can't you?
Can you see the, I've just started building on that end of her jaw, so that's already hit that bit of the jowl, and then when we start working,
it's going to pull that forward, isn't it? So yeah, excellent stuff. You can see the difference now. Trendy's just saying, yeah, absolutely. And I think by the time we've finished, it's going to be very interesting. Yeah, that is amazing, Emma, isn't it? So you're placing that on the jaw. So we're using a very thick filler. Some people get confused, don't they, that sometimes you have to use sub-Q for the jaw and you can't use sub-Q anywhere else. But actually, all the different is the thickness of the filler, isn't it?
Yeah,
and in some countries, people use sub-Q on the lips because some Middle Eastern people want that. I mean, we don't do it, but
yeah, they want that very,
very strong look. But meanwhile, as we're here, we can see what you're doing. So this is 3 mil. Yes, it's onto the bone, Shay. But as you can see, because this filler is super kind to the patient, I mean, is it any pain at all? No. Can't feel nothing. And it's all down to the fact that this is a medical grade filler. So it's normally £180 a mil, but we have a 3 mil package where it costs you £360 for 3 mils, which is what you sort of need. So how much have you used so far?
0.5 mils.
How much?
0.5 mil.
So if you used half a mil, and this is what you were saying about achieving the same result without
subtle enhancements. Don't need that much filler to create,
So a little bit about us while Bina's just doing that bit there, and I'm going to go around the other side in a minute. We're CQC registered, so we're all nurses and medical staff. Being CQC registered just gives you that extra layer of confidence that we are all medically trained. The place is of a standard to allow cleanliness and patient comfort and patient safety. Pain level, Mandy?
No.
Nothing. Yeah, it's brilliant. And now you can start to see what Bina was talking about, that gel now seems to magically have disappeared without the need of threads, which Mandy can't have because of an autoimmune. And I mean, when would she have to repeat this, Beans?
Oh, well, this will last her quite a while, probably in the next year and a half, 2 years. Yeah. Just slightly move your jaw this way.
Oh, it does look amazing. Collagen, no, because this is, if we were using the double-ended needle threads that you've seen us use before, then one of the benefits is that collagen. This is just pure filler, but it's a medical grade filler, so it's 24. Emma says, hello, is Bina placing bolus or using a linear threads? We're not using threads on this, Emma. This is purely filler to get rid of that appearance of jowls, and you can see what she's done, and you've actually achieved that, Bina. It's quite incredible, actually.
So I've basically got my base, and now I'm just perfecting it.
Yeah. And now she's hitting that bone. She's now extending that chin out, which is away. And if you've been, I've literally kept this camera here on purpose. So this was the angle that we started at, where you could see that jowl. And if you remember, Bina pointed it out, and in a second you'll see that it's now gone. So this has got rid of that jowl that obviously a lot of people hate, without the need for a thread, because unfortunately this patient can't have it. Oh, it looks amazing. And when the jowls are gone, it just naturally takes some age off the patient, doesn't it?
Definitely. It gives you that 10 years younger look, because jowls is the first thing that, just gives away the aging.
Shay says, incredible work. Thank you so much, Shay. Yeah, it's just great to see. And that's what we're demonstrating here, that with a small amount of filler and the right filler, you can achieve a very subtle look, but actually has a massive change without people. No one's going to look at Mandy when they come in here and say, oh my God, what have you done? And that's the acid test, Bina, isn't it?
Yeah.
We don't want people to say to any of our patients, oh my God, what have you done? Yeah. We do want them to say, oh, well, you look fresh. Yeah, you look fresh, or you look good. And that goes for anything that we do, whether it's Botox or fillers or whether it is skin boosters. That's got to be the ultimate goal, hasn't it?
And like this might look like I'm injecting a lot of filler, but I'm not. I'm just going in so many times because I do micro boluses, so literally tiny little amounts, but frequently. So I get that precise.
And you can literally see how that has got rid of that jowl. Oh, thanks, Rose. You guys are amazing. Come from Rose. Nice to see you yesterday, Rosemina.
And if you slightly turn your drawing.
So Rosemina was enjoying the cashback club yesterday, Bina, I see. Yeah. So for those who don't know anything about our different clubs, we have a club where you pay £99 a month and we give you £180 worth of credit. And you can use that across the whole of the clinic. So if you want to see a private doctor 1 month, then you can. If you want to have a drip, or you want to have a physio or osteopath, or just a nice massage, or you want any of the beauty products, or in fact you want some filler or Botox, it's all in there. I'm
going to set her up just to see how that works.
So Tasteful Butterfly says, love the cashback. Who is that then? You made me look... Maybe a new person. That's lovely. Golden H just said, why have you not used a cannula and multiple boluses?
Just the technique I prefer. Yeah. And that side.
Oh, it's Sophia. Hiya, Sophia. Yeah, of course. Now we know who you are.
Towards the chin.
How do you look, by the way? Because she had some work done last week, didn't she?
Is she on there?
Yeah, she's on there. So if you just joined us, Bina's almost finished the one side. What we're doing is we're demonstrating hotter than ever. Yes, you are. We are demonstrating how to get rid of jowls without using threads, because this particular patient has an autoimmune disease, so she can't have threads because they would be seen as alien. What did you say it was? Alien what?
Yeah, so her immune system's very weak, so she's prone to get infections, and yeah,
it's just not worth it. Yeah, and that's one of the reasons why we're doing this in our theatre. So we're CQC registered, and we have a theatre for minor treatment ops and stuff down here. And of course, it's a nice sterile environment. Bloody cold though, Bina.
No.
So you're just adding to that chin, are you?
Yeah, so when I set her up, I just wanted to add just a little bit more there to further define it. Why is so obsessed?
Don't forget to like and share this live so you can see it. Pain level, Mandy's nothing, I guess. Yeah, nothing. And that's all down to the type of filler and also obviously the skill of the nurse, what she's doing. It looks lovely, Bina. And if you were here at the very start, you'll agree with me that jowl has now magically disappeared. How is that, Bina? How has that happened?
Yeah, so we've basically gone around the jowl, so we've not injected into the jowl because that's just going to make it a lot worse. So we've gone around it and we've kind of hit that illusion that there's a jowl there.
Fantastic. So it's almost like a magician then.
Yeah.
Hey, Fashion Daily, how are you? Good to see you back on. We're 65 Beauty in Brentwood. We're a CQC registered clinic. We have a clinic in both Brentwood and also central London. And we're just demonstrating how we can get rid of jowls. So it's a demonstration, education purposes, just showing you what we're doing and what you need to expect, and proving the point that actually a little bit is better than a lot.
A little bit goes a long way.
A little bit goes a long way. That's right. Look at that. So that side is completely done. I'm going to swap sides in a minute with the nurse, and I'll keep the camera on the same angle so you can see that jowl disappear because it's gone. And a lot of people. Oh my
God, your jaw looks so sharp.
Yeah, it's just taken years off her, hasn't it?
Let me show her that side. Really sharp. I'm going to use your phone, Olivia.
Oh, wow, that's lovely.
Yeah.
Oh, crikey, yeah. Oh my God, that's brilliant.
Yeah, it really is good.
Wow.
Okay, let's do this side.
So what I'm going to do, I'm going to stay here like last time, and what we'll do is we'll have a look at that. Yes, it is fillers at this stage, shockwave therapy, just fillers, and we're demonstrating how to get rid of the jowl appearance. So if you see her side, we'll get Bina to explain it again. So what are we looking at, Bina, here on this side?
I'm just get my light right. So yeah, so you can see where the jowls have, she's got pre-jowls, so this is where the fat pads shift downwards and you get this heaviness. So what we do is we place filler on either side of the jowls to hide that illusion and give her that straight, refreshed jaw.
Excellent. So if you keep an eye on that jowl, I'll stay in the same position so you can see it just disappear in front of your own eyes, which is what we saw on the other side. And you'll notice as well that there's very little swelling. That's all down to the type of filler, Bina, that you're
Technique,
using.
yeah,
and the technique.
the filler you use. Yeah, all these scratches.
And you can see how still she is. It's got more lidocaine per mil than non-medical fillers have got, so it's a lot more comfortable. In fact, we had a daughter come and see us the day before yesterday because she was going to a party on Saturday, and then her mom turns up yesterday because she was concerned about swelling and hurts. It's called EQ. It's a medical grade filler. It's a lot more expensive than normal fillers, like the sort of branded fillers. If you are in the business and you want us to talk to you about it, then please give us a call. Curly Cars, yeah, it's been a bit of a tough period since Christmas to get back online, but we're back now, and you'll see us at least once a week. So what was I saying? Yeah, so if you are one of our peers and you want to talk to us, we love working with other clinics. There's lots of things we can offer. We can give you access to our suppliers so that you can see where we get our fillers from and obviously start using it. We do masterclasses with the nurses so you can learn some of the advanced techniques. We also help you with CQC. So if you want to be CQC registered, then you can work with us on our CQC services where we'll umbrella you to start with and get your application in. We're obviously CQC registered here. Curly Cows, we are demonstrating how to get rid of jowls when you can't use threads, because what we would do most likely for patients that can have threads is we would use a thread here, Bina, wouldn't we, and just lift this up for two reasons. One, because you get a much sharper approach, but also the quality of the skin will improve over time because of that polylactic acid and caprolactone material. But this lady can't have it. So Bina, do you want to explain what you're doing again?
So with the filler, we're hiding the illusion of the jowl by placing filler either side of the jowl. But if we were to do threads, we are actually dealing with the jowl itself. So that would lift the jowl, but also stimulate collagen, which will thicken her skin and stop that from becoming saggier over time. However, obviously we can't do that in this case. So we're using filler to mask it.
And I'm purposely not moving because when we did the other side, a lot of people were on from the start and you can actually see this jowl disappear, which is really the technique that we're demonstrating. As I said, if you are a practitioner and you want to come and spend some time with us, you can. We give you access to our suppliers, so you can start using the same sort of filler that we're using. And be taught how to use it. So there's lots of options. If you're a patient and you want to come down, then if you contact us whilst we're live, don't forget you can claim that 10%, which is really good. All you've got to do is send us a DM now and claim that 10%. Have you looked at our cashback clubs? So I know there's a lot of patients on at the moment, so hopefully you'll make a comment about it. we're helping patients afford treatments by using our cashback club. So you pay us £100 a month and we give you £180 in credit to spend or to save up. You can use it across the whole clinic. So whether or not you want to see a doctor, a private doctor 1 month, have a drip, have some filler, have some Botox, or have a facial, or come and see the osteopath or the physio. Cody Cass says, I bought some of your products in your basket. Oh, thank you so much. Look at this disappearing.
So I'm almost done with the individual.
So yeah, so if you do want to join the Cashback Club or grab any of our deals, if you do it whilst we're live, you can just grab that extra 10% discount off. So the 3 meal deal, which is what you see Bina using at the moment. So it's been 3 meals that she's used so far. It's £360. So if you contact us whilst we're live, that gets it down by 36 quid. So you can do it for 336, which is pretty cool actually. And this filler should last 2 years, year and a half, 2 years, depending on lifestyle. Sonia says, what's it good for? So fillers is good for lots of things, Sana. In this particular instance, what we're demonstrating how to get rid of jowls using filler. So
Just gonna have a look.
you've seen Bina do the one side, and now she's doing this side. And you can see how that's created. Yes, Sharon, we are coming to Southampton at some stage. We just need you guys to get booked in. Doesn't it migrate though? No, not at all, Kate. It depends on how it's done. Obviously, filler can migrate, but what you've seen Bina do is do small amounts and lots of it. So that's stuck on the jaw, isn't it?
Yeah, so that's down to the jaw, which can't really move.
Someone says awful. Thank you. We like you too. So does it? No, this won't migrate at all. A lot of you have met me and you know how much filler I have in my face, and it just doesn't migrate if it's placed properly. Migration happens because people have too much of it.
Too much filler, wrong
placement.
Too much of it,
wrong placement, yeah. Wrong type of filler.
Yeah. Not knowing the anatomy, so you're misplacing
Chappie 2 says, what about using Botox? Yeah, we could have used Botox by sticking it in the masseters and the DOA, which would have lifted this, but it wouldn't have lifted it to the extent that this has done. So if anything, we would use filler and Botox together if we could.
Yeah.
Whereas with this demonstration, we're just purely using 3 mils of filler. So we're now moving on to the top part of her face, which is her...
I'm not done yet. I just got a little bit more.
Oh, she's doing a little bit more. So we're going to end up using 6 mils of filler on Mandy today. And if you hang around to the end, I would applaud you to say if you could actually think it's overdone, because it won't be. Obviously, any haters are going to say anything's overdone. Christ, you could put 0.5 mil and it would be overdone. So I'm talking about real people that know what they're talking about. Please stay to the end and you'll see what 6 mils of filler in a face looks like. Someone said you look like Ruby Wax. I'll take that as a compliment. Well, as long as it's not Ruby Wax now when she's dead. But is she dead?
No.
Oh.
She's not dead, is she?
I don't even know who she is.
Caroline says, does it hurt? No, younger. Yeah, I thought they meant younger. No. Younger Ruby Wax. So look, I've deliberately left this camera in this position. Someone said, this is an interesting question. Wild166 says, does everybody need facial balancing or can some have it naturally? What a super question. I don't think we've ever been asked that question before.
Well, facial balancing can be done naturally. No one's face is ever symmetrical. So the whole idea of facial balancing is to be able to kind of achieve that symmetry in the face. And yeah, so you can do it really subtly and
yeah.
naturally.
So I think the answer to your question is probably no. Nobody has the same Everyone has a good side and a bad side, don't they? I know some
No one's
people call
face
it
is
the happy
symmetrical.
side and the sad side, or the.
You don't do the same.
What? Does the specific area hurt after a few hours? Good question, Sana. I know that we're having some really good questions today. Yeah, it can be a little bit sore because obviously we're putting a needle onto the bone,
A bit tender.
but nothing that
Yeah,
paracetamol wouldn't sore, to be honest. But during the process, you can see that. I don't think you can even feel the needle, can you? What can you feel?
Occasionally.
Yeah.
Certain areas, right?
Yeah.
But we use
not
a medical grade filler called EQ, and it's got 24 milligrams of hyaluronic acid in, plus more. Yes, dark circle, Sana, that's something that we were demonstrating earlier in the week. Yes, we can. We use a couple of techniques for it. Please get in touch and we can talk about it. Wild166 says, if I was to get facial balancing, how often would I do it and what type of filler for movement? So yeah, we would be using this same filler here because this is super stuff, and it gives you that natural look and the ability to also move. We also use this filler sometimes on foreheads if people have got Botox resistance here. What was I just saying? Oh yeah, and our filler lasts up to about 2 years. Now, depending on your lifestyle, we'll take that down. So it loves water, hates exercise. What could you do for Miller bags under the eyes on the cheekbone? I think we'd need to have a look at how serious they are. But again, they can be treated. If you want to send us a photo, if you do that whilst we're on the air, don't forget whatever treatment we recommend, you'll get 10% off. That looks lovely, Bina.
There's a bit of an indent there.
What do you think?
No, I'm really happy with that. It's amazing.
So I'm just trying to stay in the same position so you can see that how that jowl has disappeared. She has done an amazing job, I've got to be honest. And you can see how natural it looks. There's no lumps on there, no bumps, no bruising. You can see the patient's been still all the way through this because we're using that local anaesthetic in there, which is really good, a lot stronger than the cheaper ones you get.
You want to put your head this way?
Yes, it does, Wild166. It degrades. It should degrade over a period of sort of 1 to 2 years, but filler has been found to stay in the face for up to 10 years. Again, if it's placed correctly, we're not too stressed about it. There's so much clinical evidence about filler. Yes, Amy, this is filler. And what we're demonstrating with it is facial balancing and getting rid of jowls without the use of threads, because this patient can't have it. There was a jowl here a minute ago, Bina, but it's disappeared.
So we'll do her cheeks now. So that's done.
Wow. So were you here from the start? Can you see a difference? That's unbelievable. Do you want to show that side off, Beans?
We'll just lift on this.
What's that called? Photobomb. I've always wanted to do that.
Just need to clean that bit of her chin.
You like. Look at this. Look how good it looks. So what area are you doing now, sweet?
Her cheeks. The fine lines that run across her cheeks.
This is a really good demonstration. So if you smile for us, Mand, can you see these little fine lines sitting down here and down here? We're going to get rid of these. And last time we did this demonstration, we actually got a really good response, didn't we? Do you want to show them over there what areas, what it looks like? Because I think they're worse on that side.
Yeah. So if you smile, Yeah, so all these fine lines that run down the cheeks, we're just going to soften that out with filler. So what filler will do is help plump that out and just give it a really nice, soft looking appearance.
Now this is a cool demonstration. I remember doing this on a Saturday with Kerry, and we got a huge response from it. So do you want to smile again, Mandy? So you see these lines down here, these 5, big smile, man, come on, big smile. So if you put filler this way, going down, then it can create an illusion of a bigger cheek. But if we put it down this way, it doesn't change the shape of the face, does it? It just gets rid of those lines.
And we're not going down to the bone to create structure in the face. We're, you know, going to the dermis to just help with texture.
So the nurse is going to get her to smile. Smile, man. So she's looking for those fine lines.
Smile really big.
Big. That's it. Love this demonstration. We did this once on a Saturday before, and I think we had a whole week's of booking because this is quite an advanced technique. If you are a clinic owner and you want to bring this into your clinic and your nurses or people don't know how to do it, then please get in touch with us. You can come and do our masterclass. It's such a lovely way, and it's so life-changing because if you don't stop those lines going down the face, they're going to end up at the jaw at some stage, aren't they?
Yeah, they just get deeper and deeper. You can see it's not changing any.
No,
it's not doing structural changes.
No.
It's just
smile for us. There you go. Are you busy? Okay, can you just hold it for a minute for me? Yeah. Smile, man.
Yeah, you see that's almost softened that all. And it's just little amounts I'm placing.
Yeah. Again, no pain. No change of the shape. So when we have a look at her front in a minute, you'll see there's no change. If you was to change, she would be putting it onto the bone, nurse. And I'm gonna make my time.
That's it. I'm happy with that.
Yeah, let's have a look from the front so we can see that it hasn't changed the shape, which it hasn't. But when you smile, Mand, perfect. Soft.
It's quite hard to smile though. You need to say something to make me laugh.
Yeah. I'm not a performing monkey. Yeah, I do really love this demonstration when we do this because, as I said, I know it's a real life-changing thing because lots of women and men struggle with this when you smile and you have that line that runs down the cheek all the way to the jaw. And this is a way of getting rid of it.
This combined with anti-wrinkle.
Hi Sam. We're using a medical grade filler which has got 24 milligrams. It's called EQ. If you are in the industry and you want to get hold of it, if you DM us, we'll show you how to do that. It's got more lidocaine than some of the cheaper stuff, and you can see how smooth it is. Just contact us. Fashion Daily says, is it fine filler in those lines? No, I think she's using deep.
Yeah.
Again, with the names, don't get too hung up on it. Would you recommend, it's a nice question, would you combine injecting the DOA with toxins to help with the downward turn smile? Yeah, absolutely, definitely. But you do need to be careful. I'm assuming that you must be a practitioner. Just be really careful because underneath that particular muscle is the other muscle that will do an effect like a stroke, won't it? So if you hit that wrong muscle,
the DLI.
The D what?
DLI.
DLI. If you hit the DLI under the DOA next to the PQT above the PTR, fuck off with your acronyms, you are going to end up the patient looking a little bit like they've had a stroke. You know, if you want some time off work, then possibly, yeah, hit that DI, what was it? DIE, DIP, DLI.
Oh,
And then you could
poor.
always have a note, say you've had a stroke and just have a week off work. Why not? Hi, I'm a private loan lender message. Me directly if you're interested in getting any amount of a loan. Oh, no, I'm fine, thank you. I think someone's just bombed our live and put an advert in. Why can't TikTok ban them? All I've got to say is the wrong word and I'm banned.
Okay. And smile. Really big.
Look at
Yeah,
that.
it's
What a
gone.
lovely, lovely, lovely thing to demonstrate. So this is really a small amount of filler. She's used 1 mil on, so half a mil both sides to achieve that. But once this is settled, Bina, this is life-changing, isn't it? If
Yeah,
you're conscious of
definitely.
those lines. I remember last time we demonstrated this, we had a week full of bookings of just this particular technique, which is good. So, hi, D Happy too. We've got a couple of clinics, one in central London, just off Oxford Street, and in Brentwood. If you're more than 100 miles away from us and you spend £1,000 with us, we pay for your transport. So we have patients from all over Europe coming to see us because, let's be honest, if you're coming down and spending £1,000 with us, which isn't difficult, you've just seen £700 worth of treatment being done. We'll pay your travel down from anywhere. We'll fly you down from Scotland or Liverpool or whatever. In fact, we've got some patients who actually are on the clubs, aren't they? They're on the anti-wrinkle club and they're on the cashback club and they still live far away.
We've got one from abroad now.
We've got someone from abroad, yeah, work that one out. So we've got a lady who travels abroad, lucky her, and she's part of the cashback club. So she pays us £99 a month, saves it up, and then when she comes in, we give her £80 for every £100 she spends with us. So give us £100, we'll give her 180. So when she gets back into England, she's almost got £1,000 to spend, which is nice. And comes and has all the treatments done and then pisses off again.
Okay.
Wow.
Now, skin booster to top it off.
Yeah. So you've seen now 6 mils of filler placed in this lady's face, but I would ask you to challenge
4 mils.
4 mils. Challenge that you can't see that. Just can't see it anywhere. She looks natural still. We've got rid of those lines. Do you want to sit her up and explain what you've done for people who have just joined us? While you're doing that, I'm just going to go and see my patient, see if she can wait a minute.
And then your head back a little bit. So what we've done is we've done jaw filler to hide the illusion of the jowling. And then we've also placed filler along her, if you smile, so just along her cheeks, just to give her more plump and softer appearance in skin and face. And now just to finish it off, we will be doing a skin booster, so a polynucleotide skin booster, which will help with texture in the skin, any fine lines, and just give her a lovely glow.
We've got polynucleotide in the London bag. So I'm back, and you can see from this side how well she looks. I've got to be honest.
Polynucleotide.
Cream.
Yeah, some numbing cream. Yeah, put her some
lovely.
numbing cream. Do you know where it is in the room? Yeah, just put her a little bit on.
Yeah, it looks amazing. Bina, so can I have that then?
Yeah.
What are you going to use?
Peptides.
Excellent.
Basically the same thing. This was the Faso Boto left
Where's my one?
in the storeroom.
All right.
She's
Before-
just got magnetism numbing cream on the side.
Excellent. We're just, I've got a patient, so I'm going to be going in a minute, but there's so many people watching that will keep the live going. Yeah, we'll show you a before picture in a minute. Annie, skin booster, and we'll see her shine. So we've done 4 mils of filler across her jaw and her teeth. We've used a medical grade filler, so you saw it was completely painless. And now Bina's going to be using a skin booster with polynucleotide in, and we're going to see that work. And this is almost instant, isn't it? It sort of works as we go, and then we'll do the big reveal. So yeah, looking forward to it. So tell us about the skin booster, Vince.
Yeah, so this will help with texture in the skin. So any fine lines that we see, it will help pull that out. And then it will give her a nice glow to the skin as well. So a bit of tightness and glow.
Now, this is polynucleotide, so people often get hung up on brands. The problem with some of the brands that are really well known, you know, they've become successful purely out of marketing, but they've only got a small amount of polynucleotide in. This one's got 25 milligrams in, so it's got 10 times more than things like Lumieyes and some of the cheaper ones. And I think that's important, isn't it, when it comes to skin boosters? Not all are equal.
No. Not about the brand, it's about
The volume,
percentage
yeah.
and volume. Yeah.
Again, what's the pain level like, Mand?
I can feel it a little bit,
Yeah.
but it's not bad.
No.
You can see how the little fine lines that sit on the skin is starting to plump out.
It does look amazing. Right, sadly, I can't be here for the end, so I'm going to give you over to my colleague, Olivia, who will answer your questions. I've got a patient who can only be here for about 10 minutes. She needs some Botox done, and she needs a bit of polynucleotides done. So, over to you, Olivia.
Before you leave, can you get me some swabs, please?
Yeah.
Thank you. This side. So we're doing a technique called mesotherapy, which is lots of tiny little injections and little bolus injections. It's all over the skin. Thank you.
Do you not change needles, Rachel asked?
No, if I'm using one product now. Unless it obviously goes blunt, but...
Is it Lanergy XL?
I'm not sure
I
what
don't
that
know
is.
what
I've
that
not come
is.
across that before. Okay.
So what is this one that you've just used?
So this is nucleophil, 25 milligrams. It's a polynucleotide. Okay. Just to finish it off, we'll apply some cream. Just massage. Yeah, it's Eve Taylor.
Pronounced Plen RG. It's a very good polynucleotide.
Okay.
can use as BAP method.
Yeah, you can. But the BAP method is better for like skin boosters that are hyaluronic acid based. Because it's thicker, it will spread. Polynucleotides are better to do mesotherapy or microneedling injections because you can cover certain areas a lot better. A bit of swelling, a little bit of bruising is normal, and this is expected after these kind of treatments. So,
What is that poly called? Somebody asked again.
polynucleotides, nucleophil. There we go. You're all done, Mandy. I'll give you the mirror to have a look.
I'm sad. Oh wow.
Look at your jaw.
God. That's made a huge difference.
But nucleophil strong as is instructions BAP method. Whatever that means.
Oh wow. That's amazing, Rena.
Yeah.
Thank you.
It looks lovely. So I'll just kind of go around the face. So we did jaw filler, filler for the vertical lines along the cheek, and then skin booster. That's it. We're all done.
Wow, you look amazing.
So the cost is $360,
360,
yeah, for 3 mils of filler.
and 180 for the skin booster.
Yeah, we're all done. So we see you guys again for a live maybe tomorrow. Yeah.